joint articulation of the temporomandibular joint. Here the red color what we are seeing, this is the condyle, the black one, this is the condyle of the mandible, this is the articular eminence of the temporal bone, articular eminence of the temporal bone. So the red color structure which is present here, that is the articular disc that is going to divide the temporomandibular joint into upper joint and lower joint, upper joint and lower. So this white space what we are seeing here, this is upper joint, and here the space here white space, this is the lower joint, and that. And then here the upper joint is bigger, the upper joint is bigger than the lower joint, upper joint is bigger than the lower joint. Yeah, here it is visible. Now first we will see the lower joint of the temporomandibular. The lower temporomandibular joint is a hinge joint, it is a hinge variety of the joint. The lower joint is going to form between the condyle of the mandible and inferior surface of the inferior border of the articular disc, inferior border of the articular disc, that is the lower joint. And the condyle, the disc are see here, the condyle, see the condyle and disc are firmly attached at the medial and lateral portions. The condyle disc, see, this is medial portion, this is lateral portion, as we saw in structure of the mandible. So if we see superiorly the structure of the mandible, it will be like this. So here teeth will be there. These are the medial poles of the mandible, these are the lateral poles of the mandible. These two are medial poles, these are lateral poles of the mandible. So here the disc is firmly, tightly attached to the medial and lateral poles of the mandible, so that here medial and lateral movements are less, but anterior and posterior movements will happen more, anterior and posterior movements will happen more. Now we will see the upper joint of the temporomandibular. See upper joint. The upper joint is going to form between the articular eminence of the temporal bone, So articular eminence of the temporal bone and superior border of the articular disc, So between these two, this upper joint is going to form, and it is a gliding variety of the synovial joint, The lower joint is the hinge variety of the synovial joint, the upper one is the gliding variety of the synovial joints. At the final, both the joints are synovial joints. Last final we will see the disc function, articular disc, the disc which is present here, articular disc function. First function, it is going to increase the congruency. Okay, first function, it is going to increase the congruency of the joint. That means the presence of disc is going to provide a extra support for these articular surface. Suppose the condyle of the mandible, if there is no articular disc, it has to attach to the temporal bone. So the presence of this articular disc, it is increasing the articular surface for the condyle, at the same time temporal bone also, so that it is going to increase the congruency of the joint. And at the same time here, second one, if we see posteriorly the articular disc is big and middle it is thin, anteriorly little big, so that it is a anterior, middle and posterior. Anterior it is little big, middle it is little thin, posterior it is big. Size is different. So because of the variation in this size, the middle portion here condyle of the mandible will come, and here articular eminence of the temporal bone will come, so that here the movements can happen freely inside the temporomandibular joint.